Well, Black Maternal Health Week takes place every year from April 11th through the 17th, and regardless of some income, education, or a geographical location, Black women historically have the highest maternal mortality rate in the nation. This morning, I've got some very special guests in with me this morning. We are speaking with Dr. Kobina, Ghartey, and Janeka Harris. You guys are joining us from Ascension Seton. Thank you so much for getting up early to talk about a really important topic. So let's just dive in here and talk about some of the health disparities. First of all, Dr. Ghartey, can you tell us what maternal morbidity is and why this is something we should be talking about?
Sure. So maternal morbidity is essentially defined by any complication that's pregnancy related that can essentially result in any short or long-term consequences that a mother can suffer from. And this can happen either during the pregnancy or even within 42 days of the pregnancy itself.
Got it. Can you share more information about pregnancy-related deaths when it comes to Black mothers?
So unfortunately, historically, this is nothing new with respect to the increased rates that Black mothers suffer from maternal morbidity and mortality. So as it relates to maternal mortality, they're anywhere from 3 to 4 times more likely to suffer from maternal mortality as compared with white counterparts.
I'll direct this question to both of you. What is Ascension Seton doing to kind of try to help, narrow that disparity gap?
So in 2018, we took on the Texas AIM initiatives, and Texas AIM aims at decreasing maternal mortality and morbidity rates. We also took on, we created a health equity response committee that looks at how we treat problems in our healthcare system from a racial background. What else?
Yeah, absolutely. I think what we've realized, at a national level and also obviously within Ascension Seton is that we have to have a multi-pronged approach.
Yeah.
So as Janeka was outlining, from first and foremost, kind of using a more anti-racism lens, which is what we aim to do with our health equity response, which is something that we've started about 3 years ago as part of our quality assessment performance initiative. I have to give a shout out. It's actually an idea of our maternal medical director, my wife, Jenny Ghartey. So Janeka and I are leaders within that subcommittee. And what we try to do is first and foremost look and see if there's any obvious outlying disparities that exist as it relates to outcomes that exist within our health field, within our health system based on race. Then secondarily looking to see how we can kind of change our current policies using an anti-racism lens to make sure that we're more equitable with respect to our care.
It's interesting that you bring that up. We've done a lot of coverage here at KXAN. I've done several stories about Black mothers dying at more than any other women giving birth. And, in a report that was released recently, there was the component of racism showing that does play a role. What else is Ascension Seton doing to kind of help support Black mothers in particular?
One of the things I failed to mention with Texas AIM, they have these bundles that they rolled out that are designed to address those medical conditions that lead to that severe maternal mortality and morbidity. So we have rolled out our OB hemorrhage bundle as well as our hypertension bundle. And that's looking at how we respond to those emergencies. We've vastly improved how we respond to hypertension, which is a major risk factor for Black women. And we are actively working on our hemorrhage response as well.
Final question real quick. Anybody out there watching this morning, if they have any questions about what they should do if they're pregnant and they're worried about some of these statistics and they are worried about giving birth just because of the care that they might not have access to. Do you guys have any advice for those mothers out there this morning?
I would say first and foremost, we as healthcare providers understand the disparities that exist, and we are here to listen, and we're here to hopefully provide a much safer space that may not have existed previously. Secondarily, I would like to say that, because we are here to listen, we want you to express whatever concerns you may have and never feel as though that we will not be heard.
Yeah, absolutely.
Yes.
Well, I certainly appreciate you guys getting up with us this early. It's a really, really important topic. We're going to be talking more about this really for the next few days. So again, thanks so much for joining us.
Thank you.